Well, hello, doctors. This is a special DocPreneur video podcast. We're starting to do, as all of you know, spend a lot more time at home, as many of you are doing remote visits with many of your patients. And we thought we'd get in on interviewing some of our unique guests over Zoom. So I hope that you enjoy this next interview, and we will look forward to seeing you very soon in person. And be safe. Thank you for all you do, and we certainly appreciate all of your team, all of your efforts in the communities that you're living and working in. Keep your chins up, stay protected, and thank you for all that you're doing. Hope you enjoy the next DocPreneur Leadership Podcast. So our guest today on the DocPreneur Leadership Video Podcast is Terry Bauer. He's the CEO of Specialdocs. And Terry, welcome to the DocPreneur Leadership Videocast.
Thank you, Michael. It's always good to see you. It's better to see you and talk to you than just to talk to you.
Absolutely. Well, we're all stuck at home. We're all being quarantined, but work has nonetheless still continued. And I know that it's continued for you guys there at Specialdocs. And the reason that we want to talk with you today is for three reasons. We want to talk about maintaining and keeping that personal connection. What are doctors, specifically, we know that people in healthcare are looking to concierge medicine in the quiet times and saying, what is there that we can learn from this sector of the healthcare ecosystem that we can adopt and put into our practice, put into our hospital setting, they might not be these types of doctors, but they certainly are learning from this. We've already started to see, architecture firms, cybersecurity firms learn from concierge medicine. Mechanics firms are learning from what's happening in concierge medicine. There's probably not somebody listening that doesn't have a subscription to some type of streaming service or financial service. So we're all familiar with subscription-based medicine. And we want to talk about keeping that personal connection and not going radio silent with your patients. And what are your doctors doing about that? The second we want to talk about is community outreach. And what are your doctors doing? We feel that this is a time where, as we've said it before, and probably are sick of hearing it for those listening, it's not about being the best doctor in the world anymore. It's about being the best doctor for the world in the community that we live and we work in. And that's particularly poignant for doctors today. And then the last is, what is Specialdocs doing to support its doctors specifically and kind of getting real personal, kneecap to kneecap with them. So Terry, I'll kind of kick it off. Give us a little bit of background about yourself for those who are, and this is one of our first video casts, and we're looking forward to kicking it off here.
Well, thank you for giving us the opportunity to talk. Michael, you and I have known each other for a long time. I think we both share a real passion for physicians and for helping physicians, and then for as an outgrowth of that, if we help physicians, they help patients. And I know you and I have talked about this every day. I wake up and feel better and better because tens of thousands of patients are getting better care from doctors who are engaged, not burned out, and really focused, because they have the ability to see patients same day or the next day in a concierge model, and really focus on time and prevention as opposed to just treating whatever symptom the patient has. So thank you for doing this and for giving us the opportunity. As many of the folks who've listened to us talk before, I've been in the healthcare industry. It'll be 40 years. Gosh, I hate saying that out loud, but 40 years come the 1st of July. And I've been with Specialdocs for 4.5 years. And it's a great privilege to work with some tremendous doctors from around the country who just have this dedication, passion, commitment to patients and their care. Our company's been in business since 2002, so we're celebrating our 18th year. And we're pleased to see, even in these times where a lot of other businesses are suffering, our doctors are doing well, because I think our patients recognize the relationship with their doctor is as important as the relationship with their family. And they're giving their doctors bear hugs. And they're saying, gosh, if there's something I need to preserve in today's uncertain environment, it's that relationship with my doctor. So our practices are growing, and our doctors are satisfied, and our doctors are very engaged, and the patients are, as a result, have a, I like to call it, the doctor's the beacon of light in a rather foggy world right now.
Right. Well, and when people, and we've talked about this before, and it's just a recap for those who are first timers listening or watching, and that is, you know, we can tell that there's a move coming where the burnout is existing right now. Like, there is a lot of physicians burning the candles at all ends, at both ends, and this summer they're going to be making some drastic, dramatic changes to their own life, to their own career. And when people bump into, specifically healthcare professionals, their families, their spouses, they bump into the idea of concierge medicine for the first time, what are some of the common objections that, you know, you have to overcome with those physicians and their spouses? Because this is a family decision to move into this business model. And how do you overcome some of those objections? And, you know, there has been a little bit of media, I wouldn't say that those stories are particularly accurate. When you follow this space, you understand that when you read those headlines recently, you know, in the last couple of weeks since the pandemic, that, you know, these are opportunistic, and it's, you know, concierge medicine is a negative thing in our healthcare system. We need to get, you know, it just, how do you overcome some of those objections when you're speaking with doctors for the first time and they're saying, I just don't know if this is it, and I don't know if I agree with this ethically as well?
Yeah, great question. And you're right. We have these discussions every day. But a little bit of background. So in a traditional fee-for-service practice, they generate revenue by patient visits. And many of these practices, you've, I'm sure, read the studies. MGMA put out a study that 70% of medical groups are teetering on going out of business. Because if you think about it, most medical groups operate at about a 60% overhead, and they're seeing about a 50 to 60% reduction in revenue. So what happens in that situation? There's no safety net. And physicians typically don't have, like a corporation, retained earnings or keeping cash on their balance sheet. So a lot of these doctors are in tough shape. And then I've talked to many of them who've tried to apply for the the Paycheck Protection Program. And they don't have the accounting support. They don't have the legal support to even submit on time. And as we know, as of today, April 21st, that first round of capital is gone. So all that said, we've got a number of doctors going through the transition process now. And we asked them, do you want to put this on hold? Do you want to wait until this stops? And the answer was no. Because this way they can deliver the kind of care that they want to their patients. And they feel now more than ever, this is the most important calling that they have. Now, the other end of the spectrum is some of our doctors. I got a lengthy email from one Sunday night who I've been talking to for over a year. And he says, gosh, I'm going through this and wondering, will people be willing to pay me so that I can have a smaller practice? And we had a conversation about it, and I said, you know, you've got to decide. And it boils down to, and what other doctors have told us is, they had the choice of whether they just closed the practice, sold the practice to the hospital, or retired. And of all those different choices, they said the concierge model gave them, even though they were going to see a smaller group of patients, they still could keep their practice open and viable. So I think this is magnified the need to do this. I'm hoping that we're going to be a safety net or a safe harbor for some of these doctors who have thought about this for a long time. And maybe this will be the catalyst for them to finally say, in order to survive in a new environment, I'm going to have to do something different. And they should explore concierge medicine as an alternative.
Well, and for those, thank you for the clarification of that. And for those, you know, we've talked about this before. If you go back and listen to the other interviews over the years, is, you know, there's always this fear of, well, something's going to shut this down. It's not going to work. How do you overcome those types of objections as well?
Well, it's interesting. So one of our executives has written an article that's going to be published in the next few weeks that's talking about sustainability of the concierge model and how it can be really, I don't want to say completely bulletproof because that's a terrible term, but that it's a safe place to be for a physician. And he originally started working on the article back when there was this push to Medicare for all and all these other kind of things, but the pandemic just put a bigger spotlight on it. So I think it is one of the only ones that's sustainable. Interesting. So another doctor who I met at your conference last year, we've been talking about his conversion ever since. He said, Terry, I'm doing some telemedicine, and a lot of my patients have said, why should I even ever come in the office again? I'd rather do all this by telemedicine. So I think what's going to happen, and I actually saw another article this morning, because of the pandemic, I think people are more reluctant to go into doctors' offices. They're more willing to do it by telemedicine, but still the bread and butter of a lot of physician practices is those extensive visits, is all the testing, much like in hospitals. The reason the hospitals are asking for, $100 billion in a bailout is because there's no CAT scan, there's no stents, there's no MRIs, there's no elective surgery. So because I think we're turning healthcare upside down, and that's why we really think that the membership model is actually going to be even more sustainable under this new paradigm than it was in the old paradigm.
Well, and that dovetails into our first conversation, which is really the maintaining a powerful personal connection with patients and the importance of that. We talked last week a little bit with some doctors as well, and I noticed, I shared my own version of it, is, when the Georgia shelter-in-place order went into effect 2 or 3 weeks ago, one of the popular weather and traffic stations sent out, here's what this means 1 hour before the 6 p.m. deadline. And so I, quickly logged on at 5:07 once I heard that on the radio and sent it over to my doctor. And within the same 60-second moment of him receiving that, he said, thanks, I will send this. It's already up on my Facebook page. I'm putting it up right now. And that type of communication, whether it's just little stuff, from a doctor resharing a post that, he's something that he or she is reading, that type of thing matters a lot. And we're finding that, we understand the busy schedules of physicians right now. And sometimes some are in a tornado or a hurricane. Some are in, it's quiet and it's reserved and it's calm. But so we recognize both sides of the spectrum and everyone in between as well, and what their offices, practices, and daily routines might look like. But the radio silence that's coming from some of the doctors, or towards their patients, is patients are sitting at home and they're a captive audience right now. They're hibernating. They're looking for information. And I know every time I talk to my wife and I see her scrolling on her phone, I'm like, hey, have they found a cure yet? And
right.
It's kind of a side joke between us, and it's like there's nothing but bad news that we're reading, and the doctor is that North Star for many of us. And so what are you, how it seems like a lot of physicians quickly adapted within about a week to 2 weeks, a few weeks ago, to telemedicine. And patients have been wanting this for years and years and years. And it's something that we had to have a pandemic, it seems like, in order to push the care ecosystem and physicians specifically towards this type of technology. So talk about how quickly your physicians and how quickly concierge doctors have adapted to virtual care, virtual private meetings, video consults, telehealth, the applications, those types of things.
Well, we started out with a lot of things right away, and we thought the most important thing was to maintain that connection with the patient. So literally in a span of 2 days, we looked at some of the top telemedicine platforms. I talked to the principals at all of them. I talked to some of our doctors who had used them. We ended up with proposals from 3 of them and ended up selecting for a corporate platform, DoxyMe. I don't know if you're familiar with that one, doxy.me. And if you think about it phonetically, it's Doc See Me, which I think is kind of cute from a marketing standpoint. And we negotiated a corporate rate with them. It's so easy to use. It's fairly, you can actually get a free version, which is not as robust, and maybe you might lose some connectivity. We have a clinic version that we have for all of our doctors to have access to. And even 90-year-old patients can use it. It's instantaneous. It's HIPAA compliant. And within a matter of, gosh, I want to say a week, we had more than a third of our doctors using it. And now I think we've got over 70% of our doctors using some kind of a telemedicine platform, either one that came with their EHR or one that we helped them facilitate. And the feedback that we're getting is both from the doctors and the patients is outstanding. In fact, we had one doc who was way ahead of the curve, and we did some training for our doctors on how to best use it. So we did a video conference and an audio conference one evening and sent it out to all of our doctors so they could learn about it. So that was phase one.
Okay. Well, go ahead and talk about phase two if you've got a phase two there.
Well, before I talk about that, I want to talk a little bit about, for those people who are listening, wondering, well, am I going to get reimbursed for this? The answer is yes. So the government relaxed the standards in terms of HIPAA compliance. We still advocate HIPAA compliance, but some doctors using FaceTime or Skype, which is not HIPAA compliant. Everything we recommend is, because we don't want them to begin to use this and then 6 months later when the rules change, then all of a sudden they have to change platforms. So HIPAA compliance, I think, is critical. Secondly, is we want to make sure that it's easy to use and cost effective. And then from a reimbursement standpoint, Medicare is reimbursing at the same rates now as they reimburse for an office visit. So an E&M code of 99211 to 215, depending on the length of the visit and the time of the visit. And then there's modifiers that they can add along with that to get reimbursed. Most of the payers, I can't say all of them because it's all over the country, most of the payers are also reimbursing at the same level of an office visit. And in fact, in some instances, higher than they have for office visits. So from a cash flow perspective, insurance revenue is not as important in a membership model as in a traditional model, but it's still relevant. And so the reimbursement is good. Now, that may change as things get back to whatever the new normal is, but for the time being, the reimbursement has been very good for those doctors who are using it and coding it properly.
Well, and what type of communication are these physicians having? Because it can be, is back and forth about, a remote monitoring, numbers that are coming in, or maybe it's just a general, all skate where I'm going to send this to everybody. And that can be a little bit, touchy with some doctors, like, I don't know what to say. My opinion's not, I don't have anything new to say. Everybody's pretty much aware, but yet that North Star in our life is important. It's nice to know that there's some clarity out there that's working on our behalf. Even if he or she is working from home, as our physician, at least we know that there's somebody out there that's our advocate and that we can lean in and answer those questions. What type of stuff are they sending? What type of stuff are they communicating? And then this pivots into something else is we talked a lot about over the last couple of weeks with different doctors is, it's one thing to be truthful and factual and say, here's what your numbers are. Here's exactly what they mean. You need to eat better. Get your heart, you need to exercise. Right. Well, that's not helpful. It's all factual. It's all truthful, but it's not exactly helpful. And so in this time, how are your physicians being hopeful and helpful?
Yeah, that's a great question. So a couple things. Our doctors, almost all of them, with our help, are sending out email blasts. So we send them to all their patients so it's an efficient way to communicate. We're also now doing video blasts. So some of our doctors are more comfortable in front of a camera than others. Some we've seen them evolve from super reluctant communicators to amazing communicators. And in fact, tonight, we hold a clinical conference every week. Tonight we're actually bringing in a guest speaker who is a former CNN reporter, an author, and a coach. And she's going to teach our doctors how to best communicate by video. what to say, what to wear, how to communicate, what your background should look like, things you can do, tips and tricks, because so many people are afraid as to what to say. So it's the content, but also the delivery. As far as the content is concerned, and again, we've had clinical conferences with all of our doctors every week for the last 4 weeks, every Tuesday night. We talk about, should they be prescribing Paquinil with azithromycin? What should they be doing as far as what kind of masks? What about PPE? What about vitamin C? What about vitamin D? All these kind of things. So our group of doctors, and as you know this, Michael, our doctors particularly, and I think many concierge doctors, are fiercely independent. So it's like you get a group of 50 together and you've got 60 different opinions. But they share ideas amongst each other. They ask each other a lot of questions. And I think the group dynamics helps take all the misinformation and fold it together into something that can be delivered in a cogent way. And our doctors are innovative. One of our doctors right now, in fact, today or tomorrow, is doing a Zoom video with a dietitian. And then we edit it and then send it out to all of his patients. I felt our doctors a couple weeks ago were getting a little bit anxious and maybe sad. So we brought in a psychologist on the clinical conference and had them talk about their experiences, how to help their staff, how to help their patients with some of the psychological and mental and emotional health along that way. So we're trying to look at things that can help them help their patients. And so much of it is content, but more than anything, it's reaching out. It's sending the patients information because the patients are at home. Something that happened yesterday, which you'll really appreciate now that you're becoming, a Zoom guy, is we're going through a practice transition for a doctor who's retiring and bringing in a new doctor. And we said, geez, normally we do meet and greets or small group meetings or open houses, but in this environment, we couldn't do that. So you know what we did? We held Zoom meetings with the retiring doctor, the new doctor, and the patients. And I think we've got 4 of them scheduled. In the first 2, we had 100 people show up in 2 separate meetings. So the screen looked like the old Brady Bunch, or for those people who are older, Hollywood Squares. So people are using, and people are home and they want to hear this, and they want to hear this from their doctor. So it's content and it's delivery and it's also frequency, those 3 things.
Well, and there was one story, that we came across where doctors are saying, I'm reaching out to every patient. I'm not having 45-minute phone calls with all of them, but, some are longer than others. Some are just, check in for 5 minutes. Most of them are less than 10. But how is that possible? You and I know the answers to this. Probably many of our physicians listening do. But for those that think that is absolutely impossible, how could you do that with 5,000 patients on the roster over 3 years? That's not possible.
No. That's why in a concierge practice, which may have 3 to 500, 3 to 600 patients, it's a little bit easier, but it's still a daunting task. So some of our doctors, again, being innovators, they split it up amongst their staff because they're still retaining their staff, and they just say, okay, we've got 5 people in the office. Every day you call 10 people. Just checking in, see how you're doing. But we have found, and our doctors have found it to be much more efficient to use email, text, and video to communicate to a broader group on a regular basis.
Wow. Well, and before we touch on community outreach, I want to talk about those ways in which, you touched on the clinical support meetings, some of the Zoom meetings, but how is Specialdocs supporting its special docs? Little pun there, but how are you guys kind of working with your doctors in addition to saying, you're going to have more and more patients who are reading this stuff online. They're going to be reading something from their Facebook feed, from Instagram, and that's where they're getting their information, and it's most likely incorrect. And how do you support those docs that say, you wouldn't believe the silly questions I'm getting?
Yeah. The way we're doing it is helping them craft the right message to send to their patients. Again, either via an interaction like this, a telemedicine-like visit, or an email blast, or a text blast, or a digital video that is sent by text and email. So they consolidate the information and then send it out to everybody at the same time. And like any group of people, you've got some people who are the early adopters, some people who watch and adopt later, and some people who never adopt. And I'm talking about our physicians. So we're trying to teach them, coach them, tell them about colleagues of theirs and the good results that they're having and the great feedback. You know, we're very, very fortunate. We've got some of the best doctors in the world that are part of our network, literally the world. And a couple of them are just, you know, highly educated, highly experienced. And we had one last week who he's had a 100-person waiting list for years. And finally, somebody got through to him and said, you know what? You're so smart and you're so articulate and you write so well. Why don't we help you send an email out to your patients? And he said, I'll give it a try. Sends it out. He must have had dozens of positive responses from his patients. So now he wants to do it every week. So, you know, sometimes these doctors are reluctant because as you think about how physicians are trained, they're trained to be reactive, not to be proactive. So we're trying to help, you know, switch it around a little bit so they can be more proactive and retain that bond and reach out to their patients who are worried and who are concerned and who are anxious. And sometimes just having the doctor contact them makes them feel better.
Well, let's talk about the resource side of, you know, misinformation out there and where doctors can go to get clarity. Specifically, some of your doctors, what you're doing for your physicians is, you know, the hydrochloroquine, how we know the efficacy of the evidence behind the survival rate of getting on a ventilator. You know, what you have an infectious disease doctor
Right.
within your physician base. You know, how are you helping those physicians who are late adopters and just kind of listening in and like, I want to pay attention to what these guys are saying, and maybe I'll adopt that ideology or that philosophy on that drug later. Yeah. But what are some of the resources and topics that you guys are covering related to COVID-19, and what is life going to look like for many of these doctors? How is life after COVID-19 later this summer, this fall, early next spring going to look like for them? Has that discussion ever started to percolate among them and say, maybe I'm going to reduce some square footage, maybe I'm going to do more telehealth stuff, maybe I need to increase my square footage?
Yeah. So a number of things, because you asked a lot of questions in there. So what we did right away is our staff did an amazing job of getting news feeds on every one of our clients' websites. And we decided to use the CDC, okay, NIH, and then we were able to also find local public health data from every single market that we're in. And we put it on the front page of everybody's website, you know, provided they gave us the permission to do so. So there was a resource that was a credible resource that the patients could go and see. So that's kind of our first wave. We did the same with our company website, where we have a CDC feed. And we also started developing for our clients only a resources page. So they could go to that with a special link and see all the videos other doctors in the network have sent out to their patients, papers that have been published, credible research that is out there, so that they had almost a library to go to. And then they could pick and choose and say, oh, that was kind of cool. Can I do something similar for my patients? So again, everybody got the access to CDC, NIH, or local public health. And then at the company level, we have the CDC, NIH, and then we have a special resources page of highly vetted information.
Wow, that's impressive. And that is unique from the perspective of getting that on everybody's website, because we as patients are, you know, we are in captivity. We are willing, we're soaking so much information, and you know, we want that connection, even if it's, albeit by secondary RSS feed. You know, we visit our doctor's website or his Facebook post or her Facebook post. We want to know that that we're being informed with the right information. What is he or she reading that we need to be aware of as well? And so, a little bit about community outreach. Again, our guest today is Terry Bauer. He's the CEO of Specialdocs. And let's talk a lot about, the fear of getting out into the community, doing it seminars. We're going to be allowed to do groups of more than 50 people. Churches are starting to, we're going to do practice social distancing pretty soon. We can go get our haircuts at the end of this week here in Georgia. So talk to us a little bit about how they're getting out into the community, and what is that community, what are they going to be doing this summer, this fall, to extend that community outreach just beyond this pandemic?
Well, let's talk about what a couple of them are doing already, and they've done in the last week, which was, a little bit risky, but it worked out amazingly well. They were doing, two of our practices, virtual town halls, where they sent an email out to all their patients. They said, we're going to hold a series of video conferences like this. Send in your questions, and we'll answer them to the group. And so we did that in several of our practices, had hundreds of people participate in these. We're recording them, then we're editing them, and then sending them out. So that was one thing we did. Also, in one of the markets, one of the doctors asked me to come up with a list of questions. We had their practice, a hospital physician, and a local government person, and we did a Q&A session that we put on the city's website so that anybody could see it, just talking about the things related to COVID-19. Those are two that come to mind. I made some notes here. One of our docs is doing Facebook Live with his patients, which turned out to be really, really positive. And then a couple other of our docs have just done a series of videos that they put on their website, everything from hand washing to, the pluses and minuses of the various therapies that are out there. You mentioned the Paquinil as one of the therapies. There's many others. There's remdesivir that's out there. There's dozens of studies. And the latest trend seems to be this whole antibody thing. And as of yesterday, I heard there was over 120 companies trying to lobby the FDA to get their antibody test fast-tracked. And there's so much misinformation about antibodies. People have this perception that they've had the disease, they've got the antibodies, so now they're not going to get it again. There's also a lot of false positives and false negatives. So a lot of our doctors have asked us to continue to keep our eyes peeled to see if there is one or two that makes sense. So that answers kind of the short-term stuff. What's going to happen in the long term? Candidly, Michael, I don't think a lot of people have thought about that. As you know, we both live in Atlanta. This Friday, I guess, what is it? Hair salons, nail salons, gyms, bowling alleys are all opening. I don't know why those are the ones that are opening. And I think some movie theaters. So I think there's just a lot of things going on in a lot of different places. I candidly don't know many people who have pulled out their crystal ball to say what's going to happen in June, July, August, and September. I think people are trying to really get by this day to day.
Well, and as we dovetail in for a conclusion here with our special guest, Terry Bauer, he's the CEO of Specialdocs. It is tough to put on a crystal ball and say what's going to happen in the near future. When are things going to get better? And I'll leave you with this question, but I'll make one statement afterwards: is what encouragement, being hopeful and helpful for those physicians who are already you're working with, but are already curious about this particular business model, but also for the physicians listening who say, I'm talking to my peers tomorrow and I'm having dinner with him, or I'm not talking with my peers tomorrow, or we're doing a clinical call, Zoom meeting, and she's in tough shape or he's in tough shape. And I can just tell that I need to reach out as a friend and a colleague and share with them what my practice is about, and maybe go a little bit deeper with them. So what advice do you have for physicians that you're currently working with to be hopeful and helpful?
Well, I would say from the hopeful point of view, we know that there's a shortage of primary care doctors in the U.S. We also know the burnout rates are high and are going higher. I happen to believe, as I said earlier, I think that the concierge model, the DPC model, are safety nets safe harbors for these doctors who want to continue to practice medicine independently. And I think they just need to explore it further and see if they fit. As you and I know, it doesn't work for everybody. It's got to be the right doctor with the right experience in the right market, with the right personality, with the right patient base. All those things have got to be right in order for it to work. And so I think people should explore this. You know, and what we're finding, which is really interesting, Michael, the doctors who are coming to us are more engaged than ever before. I've got a conversation tomorrow with an ophthalmologist who wants to be a concierge ophthalmologist, and I can't get my mind wrapped around that. But we're still going to talk to her and maybe see if it does make sense. We're converting our first OBGYN practice. We're in discussions with a rheumatologist. So I think more and more people are looking for this as a safe harbor, a way to continue to practice medicine in the way that they desire, and deliver care, even maybe to a smaller group of people, but in a better way. So I'm hopeful because I think this will serve as a catalyst to get physicians to say, you know what, if I still am passionate about being a doctor, this is another way to fulfill my life's work.
Absolutely. Well, and it isn't for everyone. And but we also are starting with the more specialties leaning into this. You know, we also understand that there's a physician assistant community that's very intrigued by this, that is equally as burned out. The registered nurses are burned out too. A lot of the specialties are thinking about this. And how is the concierge medicine community thinking about these other specialties? And is there opportunity in the future for those nurses, those PAs, to do these types of subscription programs? Maybe it's not as wide as many people, as many patients. Maybe it has to be more patients. But these other specialties, you know, is the door open in concierge medicine to them?
I think it's a function of each state and what the licensing requirements are and what the oversight requirements are and what the legal issues are. So I can't say, you know, state to state to state is so different. I can tell you that we've got a PA and a nurse practitioner who have their own patient panels. So in certain states it is legal, in other states it's not. So I would say, you know, people listening to this need to explore that in each one of their states individually and see if they have the right to practice medicine, because effectively that's what this is. And then if they do, then it's a matter of how they build it from the ground up.
Well, and touching on a little bit of something that we all kind of roll our eyes at, and that is what's happening in Washington. You know, eventually the healthcare discussion comes back around and we start talking about it again, and it's on the news cycle for 3 months, and then we start talking about something else. What do you foresee? Is there anything that's happening related to HSAs, related to something that's happening in, you know, I'm not talking about right now, but, you know, that you were looking at 6 months ago, that you were thinking about will happen in a year? What are some, when the healthcare discussion comes rolling back around, and it will, Medicare for all, whatever, what are some of the things that your team is paying attention to, that your doctors are saying, hey, how's this going to impact our work?
Great question. And again, it's one of those things where you deal with the things that are right in front of you right away, and some things never get dealt with. So we're helping some of our doctors who want to grow their practices, doing a lot of digital marketing and a lot of innovative things. And literally on Saturday, one of our doctors had an inquiry from a law firm that had 17 partners. And this particular law firm said, you know what, I'm not going to wait for the government to do something. I want to take care of my people. So literally he contacted us over the weekend and the doctor. The doctor and us, we talked yesterday, put a proposal together. The law firm said, sounds great. We're doing a Zoom meeting with all the lawyers this afternoon at, I think, 4:15 to introduce us to everybody. And the law firm, in their wisdom and in their foresight, they are going to pay for the membership in the concierge practice for all their lawyers. So they're not waiting for Washington, I guess is my message here. They're saying, you know what happens in Washington happens in Washington. And Michael, you know this. You know, the proliferation of high deductible health plans and HSAs has been going on forever. I just saw some recent studies that said let's see, 70% of Americans never spend more than $1,500 out of pocket in their high deductible health plans. Okay, 70%. So HSAs are the thing of the future. I think that you know this from your conference. The laws are already in place for HSAs to be able to fund, membership models. I mean, one of the lawyers who comes every year talks about that. So I think that you're going to see more and more high deductible health plans because it lowers premiums. And also patients have more first dollar coverage, and the patients now are going to have to be smarter about the choices that they make. And we're finding the ones who are smarter saying, you know what, if I'm spending less than $1,500 a year anyway, why not spend the national average of $2,000 and join a practice where I know the doctor has the time, the interest, and the inclination to take care of me.
Well, and let's, before, our guest today is Terry Bauer, as we come in for a conclusion, or the CEO of Specialdocs, and that is, as we are digesting a lot of information, reading headlines that say all concierge doctors are, in the thousands and thousands and thousands. They're only for the ultra wealthy. And what do you say to physicians and patients who have that concept when they bump into those articles?
We hear about this all the time. As I mentioned, the average concierge fee across the U.S., not just our company, but in general, is around $2,000 a year, which is $166 a month, which is, as we all know, is what people spend on a nice dinner out, maybe a Starbucks every day, those types of things. So, in our patient panel across the country, and interestingly, we get a report every week. It's a bell-shaped curve. The midpoint of that bell-shaped curve last week was 66.5 years, but it went up to 107 years on one end of the spectrum and down to newborn on the other end of the spectrum. So you're seeing all types of people, teachers, coaches, nurses, people who really care about their health are involved and decide to make the investment here. So it's not just for the rich. Now, are there companies out there that charge $15,000, $20,000, $25,000, $30,000, $40,000 a year? Yes. I mean, and very, very few people can afford that. But for somebody to spend $166 a month, it is affordable for most of the population if their health is important to them.
Absolutely. And how long do patients typically stay a part of these practices? I know we're starting to collect some data from a survey perspective here at CMT, but with the average primary care plan reimbursed typical traditional PCP and family medicine doctor, we see that a patient will live and work around that doctor's office for about 4 to 7 years. But how long are patients staying with concierge doctors, you think?
I've had a concierge doctor for 15 years. So I'm an example. And my doctor, who she sold her practice and she retired, then she opened a new practice, which wasn't close to my home anymore. So the people who took over her practice are now my doctors. Now, obviously, I've been a student of this industry since it began in the late 90s. But the patients stay with it forever, as long as they can. And when we track patient attrition in practices, the two primary reasons that patients leave practices is relocation and expiration. Those are the two reasons. Rarely is it financial. Sometimes it is, but it's those two things that drive them away, is because once you have an experience like this, people don't want to go back, much like the retiring practices. The doctors who retire, we see 90% plus retention, even though the patients didn't know those doctors that came in, because they've experienced that model. They've experienced the same day or next day appointments. They've experienced the 30-minute visits. They've experienced that one-to-one connection that is just not anywhere else in medicine, and they stay.
Well, our guest today has been Terry Bauer, the CEO of Specialdocs. And you have been a wealth of information for so many. Thank you for what you're doing. Thank you for what your doctors are doing. We value your insight, what your doctors are talking about, what they're doing as well. And as I know, the industry and the physicians at large listening, and the patients as well, leaning into these concepts and learning more about them is the first step to a healthier career and a happier home lifestyle as well. So thank you, Terry, for being with us and being a special friend for so long there at Specialdocs. You see, I wrap that in.
You're pretty good at that, Michael. Thank you.
Right, well,
thank you for doing this. Thank you for the opportunity to talk. It was great to see you today. We haven't seen each other in a while. What's your plans for your conference? Is it still on for September?
Yeah, we're September 24th through 26th. Our first day on the 24th is a Membership Medicine 101 workshop. So it's kind of a deep dive where you and your colleagues also come in, and your physicians will come in and share really the ins and outs from a very elementary 101 perspective about what this industry is about and how to make this work in your local community. And then on the 24th and 25th, we have some great things planned. And yeah, for now, we think the social distancing precautions will be, a little bit, relaxed, but we'll still be able to do it safely, and looking forward to it.
Can't wait to see you then, and hope to see you well before then in person.
Absolutely. All right. Well, thank you so much, Terry Bauer, from
Thank you.
Specialdocs.
Stay healthy and stay well.